Hello everyone, and welcome to the Health GoLIVE webinar series. Today's episode is brought to you by our friends at Rally Health. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion. Stay on after the webinar and unwind with meditation instructor Casey Lane. And with that, I will throw it over to our moderator who joins us from Optum, Seth Zerksner.
Hello, everyone. Happy to be here today. I am sorry, I'm not able to start my video, or does that work? I'll start my video. Okay, apologize for that. Hello, everybody. We are in COVID time, so we're all working our technology, right? But again, welcome everyone, and thank you for joining today's panel. I'm Seth Zerksner, Chief Health Officer and Senior Vice President of Population Health at Optum. I'm really excited to facilitate the panel today and have this conversation. I'm joined by three folks who have expertise on topics that we'll be discussing today. The first one is a friend and colleague from the industry, Doug Grossman-McKee. Doug's Director of Health and Welfare with Eaton Corporation, which is a power management company with nearly 100,000 employees, many of whom were deemed essential workers during the COVID-19 pandemic. And we're really looking forward to having the conversation with you, Doug, and get your insights and how you pivoted workplace wellness strategies over this year. We also have Rick Heck, who's a VP of EAP Market leader with Rally Health. Rick's a licensed clinician, has been working in behavioral health space for more than 25 years. He'll share some of his strategies and insights about the role that mental health should play as we adapt workplace well-being strategies. And then finally, last but not least, we have Laura Bender-Hines, who Laura's an Optum Health promotion specialist. And she supports a large finance company, and she's also a registered dietitian and a yoga instructor. So she's a perfect person to talk about promoting healthy lifestyles and assisting her client with strategy. Laura's part of Optum Health Promotion team that provides a whole array of on-site services and virtual services, including nutrition and physical activity and ergonomics. But she's really on the ground and has some very practical and tactical insights that I think will kind of round out our conversation for the day. So again, thank you all for being here. We're having this conversation at an interesting time. It felt that just when many businesses were starting to make progress on creating a culture of health in the workplace, COVID forced us back to the drawing board and to ask, how do we create this culture of health in a virtual kind of environment, especially with more mobile, scattered workforces, what maybe we call variable located workforces. So to guide the conversation today, I'll be sharing 5 takeaways from a Rally 2020 Preventive Care in America survey. And that survey was conducted in August, so kind of, right in the thick of things, by an independent research firm, Edelman Intelligence. And the results include responses from 4,000 US adults on their attitudes and perspectives on health and well-being and preventive care. So there are kind of 5 topics that I hope to get through. We'll see. We've all got a lot to say on these topics, but one is about how COVID has basically been a wake-up call for all of us, particularly around mental health. The second one is about accessing and delayed care. The third is the work we have to do on prevention. Number 4, return to premise or return to worksite and adapting to a new environment. And then the 5th, digital health tools. Can't really go anywhere these days without talking about digital health tools. So let me get started here. And by the way, we really hope to have a little bit of a discussion. So please do use the Q&A option there and send some questions our way, and we'll save some time at the end to hopefully go through some of those. But so for the first one, I'd like to check in here with the group. As I said, COVID's been a bit of a wake-up call for many, and one quarter of employees say their exercise regime, their sleep routine, and their eating habits have gotten worse. And as a result, 58% in the survey say that they need to focus more on health. So that's good news for people, at least like me, and I'm sure others on this call who have, really been supporting that idea. So, okay, it's kind of like, New Year's resolution, but this is firing us up for a minute. So that's great. But with that, as significant as it is, it's dwarfed by the reported impact of the pandemic on mental health. And nearly 42% of respondents to that survey, again, say that mental health is their number one concern right now. It's a dramatic issue. We're seeing a lot of interest in this topic. Rick, you've been doing this, as I mentioned in the intro, for years and years. Any initial comments to that kind of finding and what's been happening now for close to a year?
Yeah, no surprise. Really, before the pandemic, we were already in the throes of a mental health crisis. Over the past decade, we've really started to see people talk a little bit more openly about mental health in general, but it's kind of ironic that it took a pandemic and the other events of 2020 to really kind of bring mental health into that national conversation. It was a tough year. It took significant toll on the emotional well-being, really for all of us, and those residual effects from that, they're going to stay with us for many years to come. We've seen some studies that show that the number of people that are experiencing signs of anxiety, depression, mental health distress, up about 450% in that 12-month period. So where they were a year ago, we've seen an alarming increase in the number of people who have suicidal ideations that say they're thinking about killing themselves. In December, we set a record in the US for the highest number of drug overdose deaths in a rolling 12-month period. It's up about 10% year over year. And we had started to see that trend down. So it's really disturbing to see it headed back up. I believe that the mental health impact from this pandemic, or really from 2020 in general, really been driven by four things. One, of course, is social isolation and loneliness. Another one is trauma, whether we've experienced real direct trauma or just vicarious trauma from watching the news or our social media feeds. We're all experiencing trauma. Grief is driving a lot of this as well. So it could be human loss, people that we know, whom we've lost, but also just kind of grieving the way of life, sort of everything that we took for granted that we used to do, and our general sense of safety as well. And then the fourth one that I think is driving so much of this is fear, both fear about contracting the virus, but also kind of the unknown. We're really uncharted territory, and we have this sort of anticipatory anxiety or anticipatory fear about what's going to happen next. So I would say that we just really need to continue to make sure that we're increasing awareness about mental health in general, that we continue to destigmatize mental health, both treatment and supporting people. And we really work with our employer groups to help create a workplace culture that supports employee emotional well-being needs across the whole continuum of distress and with a whole continuum of tools and resources.
Yeah, thanks, Rick. I mean, I think those four are a really powerful way to think about this. And, the grief and loss, people talk about what they're missing out on, whether it's a senior in high school or college or, so many different things. So we can see how all those things can add up. Just one of those alone, just being isolated might be, but all of them together. So you and I have discussed this at the beginning of the pandemic. We've been touching base along the way. People are accessing care much less frequently, and including mental health. Although we're starting to see the virtual use that we'll talk about in a bit. But Doug, I'm curious how you have seen this play out at Eaton and within your population.
Yeah, thanks, Seth. So as Rick mentioned, we had been trying to focus on mental health even before the pandemic. And we had been making some success there. We had tried a anti-stigma campaign and had actually gotten some pretty senior leaders on board. We had our COO who's been a really active voice for us to promote mental health concerns and in particular reducing stigma. So right before the pandemic, we had seen a slow, steady rise in our EAP utilization, which we thought was a good sign. But when the pandemic hit, we actually saw what we thought was a little paradoxical, which was EAP utilization went down.
Yeah,
And
right.
so as we started to take a look at that, we speculated what might have happened is that when the pandemic was initially unfolding in March, April, and May, people were just sort of struggling with stay-at-home orders, the whole emergence of this. I think they maybe almost didn't even have time to take care of their needs. So we have started to see that creep back up starting in the summer. We're not quite back to where we were. We've tried a couple of things to try and help that. We're getting ready to launch a new global campaign we're going to call Mental Health Allies, which is really just trying to get our employees aware of all the resources we have, like our EAP. We actually partner with Optum on that globally, and they've been a great partner for us, and the company work-life program. So it's really just teaching our employees to be aware of that and really stepping up if they see someone in need and approaching them, being knowledgeable, actually signing a pledge that we're going to have them to say, I'm going to know what Eaton's resources are and be willing to talk to people and help steer them in the right direction if they need help. We're not trying to make them professionals or therapists or anything like that, but we're just trying to help them aware of the resources. It happens on a Zoom call.
It wouldn't be a webinar in COVID times if we didn't have at least one dog barking.
Got it. And then sort of the last thing we're doing is leveraging people actually like Laura. We've got a couple of Optum health promotion specialists at our sites in the US. They've been tremendous resources, and we've steered them to help provide some programs, as you mentioned, Seth, on eating well and sleeping better, and trying to help with some of those work-life things and educate people about staying home with their families and education and all that.
Yeah, fascinating. You know, this idea of mental health allies. I've had a number of organizations talk about that, and I'm sure there may be some questions about how you pulled that off. But you know, really interesting strategies, just like peer champions, mental health champions, and then that idea of pledging is also, I think, really. You know, we know that when people write it down, you know, you're not going to check up on them, but it gets them thinking, and it's kind of a commitment. So really, really interesting tactics. So Laura, how have you seen this play out? I know, again, you're on the ground, you're trying to help companies implement as well as be creative around this. What are some of the things going on in your world?
Yeah, kind of similar to what Doug just talked about. There's a lot of initiatives that we're rolling out on a global scale, which I'll get to in a second. But at least in the US, where I focus a lot of my attention for my client, our most popular Optum workplace well-being presentation, not surprisingly, is the stress management skills webinar that I've been providing. Provided it almost 15 times now to date to several thousand people. And it's been, I mean, I'm pretty proud of it. I think it's very helpful because it really outlines a plan for people to create an individualized stress management plan. And the big crowd pleasers that I usually lead people through a 5-minute meditation technique. So they have a stress management technique in their back pocket whenever they need it. But in addition to that, we've also been promoting our EAP program very heavily. And more specifically, because we also saw some surprising trends when the pandemic started. One of the barriers that we found was that people didn't feel comfortable calling EAP, especially if they were in close quarters with family members and they didn't want to be overheard. So we started really promoting the text-based features or the nonverbal ways to connect with a counselor, which seemed to help a little bit. So we're going to continue to promote that in particular. And in addition to that, another very popular benefit that we enhanced over the past year was the backup childcare benefit, where instead of you bringing your child to a center, which most of them were closed during the pandemic, the enhancement was a discount on in-home childcare as well as in-home elder care, because we were finding that employees were experiencing a lot of stress from caretaking, and especially if you were in the sandwich generation where you were taking care of children and elderly family members. So that has been extremely helpful to many employees, especially over the past year. And lastly, like I said, our global initiative that we launched in the third quarter of 2020, our chief of HR actually is spearheading a global mental and social health campaign. And it really, she called on all of human resources to come together and get really creative and pretty scrappy to create all new programs, a communications plan around it. We also leveraged the Optimum Workplace Wellbeing resources to create some international resources that we could really rally around. And it's been really great so far. So we're continuing that into 2021 too.
Yeah, I love that. Let's remember, this is global. Yeah, that's what we mean by pandemic, right? And even to that part about us feeling a little bit alone, everyone in the entire world is experiencing this. So it's pretty unprecedented. So those are really interesting approaches. Thank you so much for this. You know what I want to do is take a minute and take a poll. So everybody in the audience, we're going to put a poll up right now that I'd like for you to just take a second to respond to. And the poll is, the question here is pretty straightforward. How have you changed your mental health strategy? And you can select as many as you'd like, as many as, apply. And we'll see this real time in a second. We'll give you just, maybe 30 seconds to do this. Then we'll look at the results and I'll ask the panelists to respond to it for a second. So again, how have you changed your mental health strategy? We just heard, quite a bit of brainstorming going on, et cetera, on that. So, okay, let's see what the results look like here. Okay, so what we can see from this is about 6% say changed our EAP provider. We have seen a few people that said, look, our EAP, it just didn't live up to expectations. Some have added resiliency, that's popular. Upgraded our EAP services overall, the number of calls, right, from 3 to 6 or what have you. So that makes a lot of sense, but it looks like added more well-being offerings or virtual events, yoga, meditation. That was pretty darn popular. And then increased communications. So not shocking, but I will say that this one about adding more well-being events, one of the other findings we found from a study is that people found it very hard to keep their routine going and to, continue to do their eat well, their sleeping habits. It was just their whole kind of environment was being disrupted. So, that to me makes a lot of sense in a way that in addition to these mental health things, really our whole lives got turned upside down. Rick, I don't know if you have a couple of thoughts to reactions to that or overall as the conversation evolved, but love to hear you comment on some of this.
Yeah, I think some of the things Doug has done are just right on, exactly kind of where I would consult to employers about steps that they should take. And looking at that survey too, I think it revealed a couple things. One thing is make sure you have the right providers in place. So your EAP, your mental health providers, make sure they're living up to what they say they're supposed to be doing. Make sure that they have robust set of tools and resources. I would recommend to employers moving forward that they really make an effort to make mental health and emotional well-being a top priority. So really build an organization-wide strategy that's supported top-down and bottom-up. So things like building a culture where employees feel safe to talk about mental health and where they feel comfortable getting the care and support that they need. That includes open and honest communication, from empathic leaders who share their own struggles. So similar to the great work Doug just shared about their COO, I think it's really important to develop a year-long communication strategy that really focuses on increasing awareness about what mental health is, really to help normalize it a bit, continually working to reduce stigma, to make it okay for employees to really ask for help and seek care. Ongoing promotion of tools and resources that are available to them. Laura mentioned something that I hadn't even really thought about, is the fact that people who are in close quarters might not feel comfortable, even though we've made care easier through virtual treatment. A lot of people would feel really stigmatized around their own family members or roommates. So having access to digital tools is really a great point. And then just, it's really important to keep the message in front of your employees all year long. You know, a lot of people will launch something during Mental Health Month. It's important that every month of the year or every week of the year, that there's some sort of messaging going out to your employees. It's sort of like when you're in the market for a new car, every commercial that you see on TV is a car commercial. Those same commercials are playing all year long, but you're not in the market, you're not thinking about it, you don't need it, you don't pay attention. It's the same when you're talking about mental health. And then one of the most important things that I think an organization can do is really train their managers. So teach their managers to recognize signs of mental health distress, teach them to empathically approach an employee and say, hey, you know, I just want to check in on you, a little worried about you. And then really how to refer them to the appropriate programs and resources. Managers play such a key role in the overall health and well-being of their team, and mental health is no different. And the last thing I would mention is just sort of what Doug has already brought up that they're doing. But I think it's important for organizations to, if they really want to build this culture that supports mental health, is to consider building a network of mental health champions all the way across the organization. So it can be a separate champion network, or you cross-train your well-being champions. Either way, leverage those folks to really foster this culture that supports emotional well-being. They provide communications, updates about mental health resources like the EAP, and they're sort of that go-to known entity for when people need some help or some guidance.
Great. Well, thanks for those comments. You know, let's shift a little bit, and I know we're, you know, time is already flying by here, but let's take a minute and talk about the physical health piece as well. So agreed, mental health now has been elevated, and we've talked about some strategies here. You know, it's interesting, many of the 2020 healthcare trends for employers are negative, right? So costs went down because of delayed care, deferred care. Some are counterintuitive, fewer heart attacks, less preventive exams, but there were more musculoskeletal issues due to ergonomics at home, things like that. And again, one of the positive trends is people are looking, though, to be a little healthier, and, you know, all this dryish January and other things that people were trying to do. So again, Laura, I'm curious, just kind of earlier you talked about, you know, some of these issues. What else is going on in terms of a culture of health in this, you know, kind of in our new adapted world?
Yeah, I mean, everyone's shifting to virtual, which is not super surprising. So it's been more about just making sure that that's as accessible as possible and as easy to use as possible. So a couple of things about that we were finding. Even before the pandemic, my client was already working towards a more virtual platform in terms of all things health and wellness, just because of the very diverse footprint, and a lot of employees were already working remotely, at least part-time.
Right.
And in 2020, well, actually in 2018, we were already starting to promote virtual visits and using digital platforms to get care. And we, of course, saw that really spike, especially in 2020. And in particular, we saw over 200% increase in live virtual wellness event participation, as well as our virtual visit metrics, which I'll actually get to later. But in terms of the wellness events that I was providing in 2020, we saw incredible engagement in all of our virtual events, and it was very well received. And I have multiple theories about why that happened, but the pandemic was definitely the main driver behind that. And in addition to that, we've been encouraging the importance of staying current with care with our virtual visit promotions and making that as accessible as possible, even promoting several different apps depending on what people felt like comfortable with. Thankfully, because our medical provider was covered on all of them. And then we saw about 125% to 200% increases in virtual care each month compared to those months in 2019. So people are definitely taking up all of the offers when it arrives in a virtual capacity now.
Yeah, that's some of the data around there really is interesting. So, while telehealth's been around for a while, to your point, we really saw it soar. According to that Raleigh survey, we saw 1/3 of employees scheduled their first virtual medical appointment. Nearly half were more willing to use medical appointments now going forward. And we're not seeing it fade. We're seeing it take a little bit of a dip, but we saw over 1/3 say that they'll stick with virtual visits even after the pandemic ends. And we're seeing that while a lot of employees can't get all of their routine medical screenings, like a mammogram via telephonics, there's more, other things that people may be able to kind of do, and virtual visits around mental health, behavioral health, like we're talking about. So let me switch to our next topic, which is very much aligned with this, as Americans are delaying their care. And we touched a little bit on this earlier, but related again is one of the biggest stories. More than 1/3 say they're avoiding visiting care providers until the pandemic is under control. And that means putting off recommended screenings and missing medical appointments. So we touched on this earlier, but at some point you need to go to the doctor. You can't defer it all. And, sadly, we know that the National Cancer Institute predicts that there could be even 10,000 more breast and colorectal cancer deaths over the next decade because of all these delayed screenings and early detections. And, there's a big dollar impact on that, close to $65 billion. So, Doug, I know you've been working, to get your people back into the system. You're watching preventive screenings. How are you taking this issue on?
Yeah, we did see about a 15% drop in preventative visits, as you talked about, Seth. I think people were avoiding going to the doctor, or told to stay away from some of the routine care from both their providers and hospitals. So we've been trying to work very actively to bring back the communications, I think, as both Rick and Laura have talked about. We partner with UHC. They've done a tremendous job with us to get out all our campaigns around all the things people should be doing. So just as an example of that, we're getting ready to send out all the heart health for this month around cardiovascular disease. And so we continue that campaign to try and get that in front of folks. We do a monthly newsletter and are trying to go not just in the US, but around all our countries too, to make sure people are taking advantage of that. When the last fall came about, we had over the past years done a lot of on-site activities such as biometric screening, which we think is tremendously important in giving people that, we'll call it their health scorecard, to really get them started across diabetic risk, cardiovascular risk, and some of the other lifestyle risks. And so we thought long and hard about that, but decided to proceed with that. And we're pleased to see just a little bit of a drop off, but not quite as much as I referenced a moment ago. So we went ahead with our on-site campaigns. It was done safely. Most of our manufacturing sites, I think, as you mentioned earlier, stayed open during the pandemic. And so we wanted to make sure we were getting to where our employees were. And in addition to that, last fall, given the importance of what the CDC and others were talking about with the flu season, we also decided to add a flu vaccination clinic as well on site for our manufacturing sites around the US, just to make sure people are taking the best advantage of their health. So we'll continue with this strategy and continue with that communication campaign to make sure people aren't putting these things aside.
Really interesting, Doug, because as we said, if people are missing their primary care visits and some of the other things, at least an on-site biometric experience, get some of their key numbers, gets someone with some clinical background to literally look you in the eye and to see whether maybe you're okay or not, or maybe encourage you to go see a doctor. So I think, as counterintuitive as it is, on-site services could be even more important than ever in a way, given that people are deferring. So really interesting. Laura, maybe just pick a couple of highlights too of what you're seeing, especially around preventive care visits and a few of this. I know you've got, a number of things to share with us, but maybe pick a few of your favorites here.
Yeah, sure. I mean, we also saw a drop in people going for their preventive care visits. And as a result of that, we still wanted to provide employees the opportunity to still receive an incentive and do something to support their health, whatever they were able to do with everything going on. So we ended up actually pivoting our incentive strategy within the Rally platform to not only incentivize preventive care visits and preventive care screenings, but to also incentivize attesting to getting a flu shot, because we knew how important that was at the end of the year, and to complete the Rally Health survey so that they could at least get some digital support with customized recommendations to really support them with whatever they might have been dealing with, and to recommend other support within the benefits vista or ecosystem that my client had. So those are really the main things that we saw.
Yeah, those are great. Yeah, thanks for sharing that. We'll hopefully have a little bit of time to revisit, but let's go to the third topic here, which is, what I call building a fortified immune system through holistic prevention. So, that's kind of, according to our survey, only 10% of employees recognize that healthy lifestyle behaviors such as diet and not smoking or misusing alcohol or preventive care are really, key to their overall health. It's kind of interesting, right? So for me, with this whole pandemic, one of the things we know is a fortified immune system is something that will help us be less likely to get the disease. And when we do get it, if we get it, that it'll be less serious for us. So this whole idea of developing a fortified immune system, getting, better sleep, eating well, maybe kind of dialing back on the drinking. We're all kidding about how much we're drinking now, but, everybody's starting to go, okay, maybe I should regroup on this one. So this kind of COVID wake-up call, people are starting to recognize some of these, comorbidities. We even saw a big jump in our Quit for Life tobacco cessation program, because people saw the relationship to respiratory disease and risk and impact of COVID. A lot around social determinants as well. So we know that people that were vulnerable populations were being, more impacted by all of this. So, our survey, again, the research shows that employees with diabetes carry an additional annual cost of $4,300 on average. Employees who smoke carry an average $5,800, and there are productivity issues. So, Rick, again, I'm going to turn to you for a second, because these behaviors are all tied to mental health issues in some ways. Sure. We think they're stress relievers, or they're a byproduct of other things happening. We tend to eat or whatever, or, not exercise. Maybe hit a couple your key thoughts on this topic as well, the fortified immune system.
Yeah, thanks. Everything we're talking about is interconnected. So managing your mental health, just as important as physical health and keeping your immune system strong. I think what our employers can do is really help shift their employees' mindset so that they take kind of a more holistic approach to preventive care. So it means strengthening your overall emotional well-being, just like you do your physical. If you go to the gym every day, if you eat well, you also need to think about well-being habits related to emotional health. So managing your stress, meditating, whatever it is that you do. It was interesting in that survey, in that Rally survey, a really small percentage of employees identified mental health and depression and stress management as part of preventative care. It's more something people do in reaction to the stress or depression that they feel. And the research shows that stress, depression, even loneliness, all take a really significant toll on your health, and in particular, your immune system. Anytime that stress response is sort of in flight mode, in fight or flight mode, it's really starting to break down our bodies. So while stress is always going to be a part of life, learning to kind of manage it in an effective way is really important. For a lot of us, we have kind of maladaptive behavior. So people who smoke to manage their anxiety, their stress. It's not like they didn't get the memo that this is bad for their health, but it's the behavior that they've learned. For me, it was sugar. When I was stressed, I'd end up in a donut shop. So helping people learn more productive, more adaptive ways to manage their stress and depression, I think, is really important.
Yeah, thanks for those comments. Doug, how about you? What's the more holistic mindset that you've been playing out at Eaton these days?
So like Rick and Laura have been talking about, we had a big focus on physical, all the things with nutrition, fitness, and tobacco cessation. But more recently, we've expanded into what we're calling 3 dimensions of well-being. And so that includes those same physical dimensions, but we've added emotional and financial health as well. So the emotional includes some things that we think are important around connectivity and social. Our inclusion and diversity team has been really quite active and great partners in this whole thing. And our inclusion employee resource groups are really social communities inside the company. And they've been great partners to us to help look at some of the things you mentioned in the survey, Seth, about social determinants and areas that we may be missing. So we've expanded, and although mostly in the US now, we're really, particularly with this pandemic, really seeing financial health matters. And so we're partnering with Fidelity and others to help in that arena and trying to look for global strategies.
You know, Doug, you mentioned these employee resource groups. In my view, this is kind of an unused lever for engagement. These are groups that are trusted amongst their peers. They refer each other, they chat, they talk. And I personally want to really explore how we can expand these and leverage these for inclusion and diversity purposes, but for health and well-being and for mental health purposes. I think they could be a really good engagement channel. I'm really, it's very interesting that you're going down that path. So Laura, again, maybe you too can talk for a second a little bit about what you're working with some of the clients in this more holistic way.
Yeah, I mean, from a holistic standpoint, one of our most robust tool that we have available to us is a wellness calendar that keeps us grounded in our strategy. And that calendar is essentially based off of the feedback that we get from employees over the course of the previous year, and just trying to take a pulse of what would be of the most benefit to people. So for example, we closed out 2020 with programs that were related to sleep. I did a presentation about healthy eating during the holidays during COVID-19, so that we could come up with strategies for takeout and for healthy recipes at home. And as well, we also continued and actually strengthened our monthly financial wellness webinar series, which has been extremely popular, especially in 2020. And in addition to that, again, seconding the employee resource group connections, we leveraged a lot of our relationships with several large employee resource groups in a lot of the major offices across the country to do specialized programming based on whatever the membership really wanted to learn from us and from our vendors. So that was a really big push as well.
Yeah, really interesting. The financial one, I think in the past, employers have said, we have retirement planning, but people are going, no, you don't understand. I'm worried about making rent. I'm tight these days. I'm really worried. I have a lot of credit cards, all of that. And so we're learning that this financial well-being is much more basic, and it's getting a lot of traction. So we saw that before the pandemic. And sadly, even for people who weren't furloughed, times are tough, and they're helping out. New people are coming to their house, their kids are coming back, whatever. So kind of makes sense to me. So now let's go to the fourth finding, which is return to work, kind of return to premise, adapt. I'm just really calling it adapt to life, because all our employers go, of course, we return to work. We've been working the whole time, and frankly, we're pretty proud about how we've been handling it. So it's not really that, but it is adapting, right? So we've got this achieving a fortified immune system. We're looking at a big trend. Of course, testing was a big trend and still will be a part of it. Now this trend worth noting around the intent to vaccinate. At the time the Rally survey was conducted, only 1 in 4 people planned on receiving a vaccine. as soon as it was available to them. You know, the Pew Research reports Americans' intent now has risen to about 60% by December. It waxes and wanes. I heard recently it's back up there, maybe close to 60% again. So, you know, this is a big piece of it. You know, again, we know that vaccines are not going to necessarily stop people from getting the disease. It will just stop them from being hospitalized, from dying, and hopefully from having severe symptoms. And that, of course, can really help, you know, reduce costs and infection rates. So, you know, with that said, vaccination is only one piece to the many pieces that ensure a physical safe workplace. And we need to go beyond that to help people with this kind of adapt to work, adapt to life, and changing the environment. So again, you know, some people, I like to call this the big reset. And I'm wondering, Doug, on that note, if you can talk to us a little bit about Eaton and how right from the beginning you adapted and are continuing now to create a more sustainable approach.
Yeah, so as we've talked about, in fact, most of our manufacturing sites have stayed at work, and many of them were deemed essential workers in the communities that they're in. So we right away, and this is led by our environmental health and safety teams, who just have been doing a wonderful job to keep people safe. So we instituted safe behaviors, social distancing, mask wearing, temperature checking at most of our sites to keep people safe. You know, when we started hearing about the availability of vaccines, I think we thought, well, we'll just do like a flu clinic like we did before, but we're not quite there yet.
Right.
I don't think the vaccine availability and everything else is in place to do that, maybe down the road. But in the meantime, I think we're looking at doing education campaigns and communication campaigns about the importance of this. And as you said, Seth, I think we're not going to drop some of those other behaviors we've adopted to keep people safe. You know, at the same time, also, we've had to look at some of the population that's remained remote and asked either by the communities or the states to remain at home. And so we are looking at, again, flexible work solutions and trying to broaden that. We put in place some early strategies to help people who needed to either quarantine or be at home so they weren't coming to work sick. But I think this whole area of flexibility is going to be more that we have to look at down the road.
Yeah, this flexibility theme, you know, we need to learn. It's been, you know, typically not necessarily one of the strengths of you know, corporate America, but I've been so impressed how quickly organizations flexed. You guys are a perfect example of that. I think it exposed some business continuity plans for all of us. All of a sudden, if we need to get everybody to virtual, if we need to keep people healthy, if we need to keep them mentally resilient during this period. So there's still plenty to learn, but I think, you know, many of the things you just talked about really fit well. I'm wondering, Laura, again, from the quote, work from home kind of angle, you know, what are you seeing from the company that you work with?
Yeah, well, even before 2020, a lot of the workforce is working remotely, at least part-time. So that's just become even more mainstream for the company. So there's probably going to be a very large percent of the workforce that will continue to work from home. So we're basically going to continue to offer virtual programs to make our programming still as accessible as possible to everyone.
Okay.
And in particular for the global campaign, which I'm very excited about, we're currently working on and about to release a set of guidelines and remote work culture norm suggestions that executives can actually lean on and start to incorporate a new culture that really supports mental health and resiliency in the workplace. So that's one thing that we're going to really kick off 2021 with and keep mental health a top priority.
Yeah, I think it's been really hard for managers to keep pace with all of this. So the more that we can feed them information and guidance and how to be comfortable with some of these conversations is really important. You know, Rick, maybe a quick comment from you on all of this as well. Love to hear your thoughts.
Sure. And, you know, with regards to the manager piece too, it's a lot of managers are struggling as well. So we need to make sure they're taken care of. But I think overall, this is one of the things that's really interesting to me as a social scientist is to think about the whole return to work and the return to society for all of us. But from a mental health perspective, I think it's really important to remember that a lot of us are going to continue to kind of actually struggle emotionally when we return to the physical workplace. We've seen residual trauma from other events like 9/11 and different environmental disasters. So it's important for employers to be aware of that that's going to happen. As I noted in the beginning, some of this trauma, this anxiety, the isolation, all this, it's going to impact us for several years to come. It's not something to think about. People are back to work and things will start normalizing. They won't. I think from a psychological standpoint, the two biggest factors that will impact people as they return to work, certainly the anxiety and fear that people will have about going back to the office and it being safe. And again, sort of the post-traumatic stress that all of us are experiencing. But I think the other one that's really interesting to me is the resocialization into the workplace. So people are going to need to sort of reacclimate back into the culture and begin to resocialize after really not having been around people for a long time. So it's this muscle that many of us haven't flexed in a long time. I don't know about you, but when I'm out with my mask out in public, I still have this reflex to lean away from people. We've been doing that for a year. That's not just going to suddenly stop when we go back to work. So it's going to be going on. And I also think it's going to take some time and effort really to reestablish connection. So both collegial working relationships, but also these authentic supportive connections that we really have that we've been missing the past year, and sort of the water cooler talk where a lot of info is exchanged. We're going to have to relearn a lot of that. So overall, I think there's going to be some challenges and residual effects that we're not thinking about today, and just would ask employers to really be aware of the potential issues and just be prepared to navigate it.
I think that's right, Rick. I think the whole idea of, really that this is going to last a bit. There's residual impact. And well, let's jump to the last point here, which is using digital tools. We've all mentioned how virtual digital's really been a big deal. One way to help people with both their physical and emotional. Data from the Rally survey show that 71% of employees who use the digital tools feel optimistic about their future. So that was actually like, hey, this is good news for me. And that 65% actually think that that's helping them be more in control. So when the employees are feeling more empowered and make more positive changes with their health goals, it's kind of all a virtuous cycle. So, that part we're seeing with social distancing and adoption of kind of digital tools that have accelerated even, putting barriers down. People who didn't want to go on-site fitness are now don't have to deal with a locker room, don't have to sweat in front of everybody, don't whatever. So doing it in their home, we're actually seeing an uptake in not only the people who used to do it, but new people. So I think there's some really interesting insights there. Laura, I know you're really close to this with virtual fitness classes and things like that. Maybe share for a second, what you're seeing, especially in terms of the adoption of virtual types of well-being programs.
Yeah, I mean, I'm very lucky to also have a partnership with the Optum Workplace Wellbeing On-Site Fitness Center in one of the major locations that my client has, and they have been so graceful and gracious in actually pivoting to a virtual format and offering a lot of classes for free and almost open invite. So it's made my job very easy in being able to share virtual fitness classes with the employee base. And I personally have taken them and they've been great for me as well. So that has been a lifesaver over the past few months. But also using Rally a lot of the time, a lot of my wellness champions have been creating user-created step challenges to have these informal, friendly types of movement challenges with each other to keep each other moving and also kind of nudge each other throughout the day to see who's winning. So that has been really helpful too.
Yeah, that's great. So Doug, how about you? What are you seeing in your world with people adopting virtual and digital and all the rest, even though you've got on-site?
Yeah, so actually, like Laura's is speaking about, we asked all our on-site folks to turn and start offering things virtually. So we had a big uptake on one-on-one fitness and virtual personal training and asking all our experts to start offering well-being breaks. And those not only had the benefit of letting people tune in whenever they could, but also being able to be broadcast across other sites across the country and actually globally. A number of our well-being champions picked that up globally. And then in the US, we've relied quite heavily on our partnership with Rally. And, as you all know, the Rally is sort of expert in getting people to get a sort of a personalized, customized experience to where do they need to go, and then pointing them to these missions and other activities that they can do in small chunks to help them shape and move in the right direction towards better health. So we've been sort of focusing on those two pieces.
Mm-hmm. Yeah, no, it makes a lot of sense. So, we've covered a lot of ground. We've talked a lot about employee attitude towards well-being offering in the light of pandemic, and how, as an HR benefits leader, you can kind of meet some of these dynamic needs. I want to get into some of the Q&A here. I really want to thank all of you for the conversation we've had. I do want to mention that as follow-up to today's session, you'll be receiving, everybody in the audience, you'll be receiving a copy of the Rally ebook that's got how to future-proof your well-being strategy, and it's the insights from this survey. So we've all been rattling off statistics here and there, so you'll see those. But I'm gonna scroll through the Q&A for a second, and then dish out some questions. But there's one right here, and I think this one's for you, Doug. And it's, what's the most effective change you've made to optimize your well-being strategy during this COVID period? You've made a lot. Everybody is still, trying to be sustainable about this. What do you think has been kind of the big key, best things you've done?
Yeah, I think as we've been talking about, and some of this was by necessity, but the switch to virtual is so it opened it up to more people. It sort of picked up on that uptake. I think as Rick and others and Laura were talking about, it had been there, but it's slower uptake. And so this sort of brought it fast speed up to the forefront. We hope that sustains. We're going to continue to promote that. And I think the other thing I mentioned was around flexibility. We need to look at hearing what the needs are, but being able to approach flexible work schedules. A lot of people have been at home, and it's right now, maybe some of the COVID restrictions keeping them there. But I think they've also maybe gotten used to being at home, and we have to look to how we going to keep them engaged in the workforce and let them have that flexibility they need and still be highly productive workers with us.
Yeah, interesting. So I've got a couple other questions here. I'm going to go to you again, Doug, but then maybe open it up a little bit more. We talk about social determinants of health. I have some thoughts on this as well. But we know just because someone's employed, it doesn't necessarily mean that they're completely thriving. This is early days, but how's Eaton been thinking about some of these issues?
Yeah, I'd say we're in the beginning stages of this. We are trying to look at benefits that we can take, and again, it's sort of starting in the US more so than other countries. What can we offer that is really meeting the needs of the people? So, how can we broaden some of those things? What are beyond sort of the usual things? So we target things like cardiovascular disease and diabetes and other things that may be more chronic indicators, but other populations where that's more relevant, or we can do things to help bring that more to the forefront. So again, I go back to what I mentioned about our partnership with our IERGs to hear, and they've been a great sort of, as I think you mentioned, Seth, sort of getting to that target group more. They really are powerful spokespeople to be able to reach their members and bring that message. And a lot of times the benefits may be there and just not being taken advantage of. Sometimes there are gaps that we have and we need to be able to fill them. So we've brought about some changes pretty quickly than we normally have done. One was around, some paid parental leaves that we brought to the forefront pretty quickly. So we need to do more of that. We're just on the forefront, I think, of looking at this.
Yeah, I think it's a big topic and we could spend a lot of time. I know that there are some some efforts to refer people to community services and resources and kind of bump up the philanthropy and connect people.
Seth, if I can just chime
Rick,
in.
I think I've got a question for you.
Okay.
And you can weave in some social determinants if you want, but can you discuss specifically how to address the increased anxieties for employees with chronic conditions? So how to empower them with managing their chronic conditions, so stress, anxiety, and that piece doesn't kind of come in, especially in these trying times.
Do we have another hour to talk about that? First, I just want to make a plug for employee assistance programs in general for all the employers out there listening in.
Yeah.
When we talk about social determinants, we're talking about financial stress was already a leading cause of stress in America prior to this economic collapse. So when people are thinking about, I need some help, I need therapy, I need something, but I also have to put food on the table, they're going to take care of their family first. So if you can promote that EAPs are no-cost visits to employees, to really open the door for them to be able to get some of the help they need. With regards to chronic conditions, we know that there's huge comorbidity between chronic conditions and mental health issue. Somewhere between 30 and 40% of people with diabetes, with congestive heart failure, several of the chronic conditions have a comorbid, co-occurring depression or anxiety, and it makes your chronic physical condition that much worse. So I would just make sure that those folks have access to some tools that can help manage the mental health aspects as well. There are certain programs out there that do just that, where they reach out to people with chronic conditions and work with them through some cognitive behavioral techniques to help them manage their anxiety, manage their stress, and make sure that they're taking care of both their physical and mental health. If you're diabetic, for example, and when you're stressed, you stress eat, you binge eat, you're going to exacerbate your medical condition as well.
Yeah, thanks for that. I've got another one here. It might be good, Laura, for you. This one, I mentioned the whole MSK, musculoskeletal issue, especially people at home. It's not like everybody has a completely set up separate office. People are working from their bed, they're from the couch, they don't have this, they don't have that. So what have you done, or what do we do to help people who are kind of working at home to kind of address the ergonomic issues that they in the office might have had somebody come by and help them deal with?
Yeah, I mean, for my client, I've also been kind of lucky that we have a strong health, safety, and environment department that has these turnkey resources to support, at least in the office setting, from an ergonomic standpoint. But with everything that's happened, they pivoted as well and created a work from home toolkit, as well as some trainings and everything, and some ways to create your own non-traditional workplace setup. Like, for example, if you wanted a sort of standing desk, maybe use an ironing board. So FYI, if you didn't think about that, try it. It works. And things
and many people out there are saying, what's an ironing board?
But in addition to that, we really just leveraged a lot of the resources that already existed, but people didn't really know about too much. So it was more about amplifying some of the stuff that may already be there from your health and safety department.
Yeah. So we just have a minute left. There's a question here that I want to take a shot at, and then maybe Doug. And it's, do employers who invest in employee well-being programs expect an ROI and measured decrease in healthcare costs? And this is kind of the age-old question. And I'll just give my quick 2 cents on this, that I have seen a real shift from a pure focus on ROI to what we talk about, which is value on investment, which is human capital. We can't basically run our business, meet our numbers without people who are healthy and not distracted. To during COVID, I coined a little term I call VOW, which is value of worker. We can't even come close. We can't do our business if people aren't back. I mean, Doug, you know this, right? And so cost wasn't really the issue immediately. It was, how do we keep them safe? It wasn't like, how much does it cost to get a temperature check or all the things that you did. It was, what's it going to take to get people back? So in the last 60 seconds, Doug, you get the closer on the value of all of this. What do you make of that?
Yeah, I would agree with your comments, Seth. I think initially, 10, 11 years ago, we went into this thinking we reduced healthcare costs. And I think we've shifted off of that. I think we're moving more to what you talked about with that value of investment. We've tried to look at some of the things around leave and absence and disability and found some interesting things in that regard. But more importantly, around recruiting and retention of key folks. And particularly now, as we look at some of the next generations and new generations coming to the workforce, sort of things around meaning and social and connectedness, and having these programs, I think, are important. It's also the right thing to do. And I think I'm proud to work at Eden, where we've prided ourselves on doing business right and trying to do the right thing. And I think, to your point, there's a case to be made for that.
Yeah. Well, thank you all so much. We are at the top of the hour. Great conversation. Like Rick said, we could take an hour on probably a lot of these, but hopefully everybody got something out of this. I appreciate the panelists, appreciate Health First, kind of the platform, and have a great rest of your conference, and take care, everybody. Thanks again.
Thank you.
Thank you to Seth and to all of our panelists. If you would like to continue the conversation, please join us on Twitter. And now, please welcome meditation instructor, Casey Lane.
Hi, everyone. Hi, my name is Casey Lane. Thank you so much for being here. I was thankful to get to listen in on the last little bit of that. I'm going to offer a 15-minute meditation, and before we move into it, I just want to acknowledge the power of taking 15 minutes to just ground and check in with our own energy, physically, mentally, especially when we're spending so much time on screen. So before we get started, I'm more than open to, if you want to lie down, if that's accessible to you, if you would like to maybe lean up against a wall. I'm not really a meditation teacher with the belief that it has to look exactly a certain way. So take a moment to get yourself comfortable and just notice almost a feeling of letting your body release into the ground underneath you. So noticing kind of where you're being held up, and take a moment to shift and adjust and find a position where you can settle into a bit of stillness. And something to keep in mind, if you need to scratch or you have an itch, you want to move your leg because it's falling asleep, all of these things are fine, right? We don't want to be still out of this necessity to not move, but rather practicing stillness and just awareness of when the fidgeting is because of distraction and not just like, I have an itch, it's no big deal. So going in kind of with a low stakes mentality. Allow your eyes to soften, or you might just gently notice your eyes gazing at the tip of your nose if you'd prefer to keep your eyes open. See if you can notice a bit of space between your upper and lower teeth, and allow your tongue to just gently rest at the bottom of your mouth. More so into whatever is underneath you. I'll guide us through a bit of breath work and then some visualization work. And if there's anything that particularly resonates, you can think that this is exactly for you. And if there's something that doesn't totally resonate, then you can just trust that maybe it was for someone else. With your eyes gently closed or gazing at the tip of your nose, take a deep breath in through your nose. Hold your breath at the top. Open mouth, exhale. Same thing, deep breath in through your nose. Hold it for a moment at the top. Big exhale out your mouth. Good smooth breath in. And with this exhale, shoulders continue to soften. And for a moment now, just observe the way your breath effortlessly moves in its own rhythmic pattern. So if long breaths feel good, you can take long breaths. I'm going to guide us through just a bit of counting breath, and it's subtle, but anytime we're inhaling, we're very gently stimulating our sympathetic nervous system. So action, energy, and every time we're exhaling subtly, we are really stimulating our parasympathetic. So ease, relaxation, and by evening out our inhale and exhale, we'll hope to find this almost circular, even rhythmic flow of energy in our body and energy releasing our body. At any point, if the counts feel too long or too short, I'm just here to offer and to suggest, but you absolutely can move at a pace that feels better. So start by exhaling on a hissing sound. Inhale for 4, 3, 2, 1. Exhale, 4, 3, 2, 1. Inhale, 4, 3, 2, 1. Exhale, 4, 3, 2, 1. Inhale, 4, 3, 2, 1. Exhale, 4, 3, 2, 1. Inhale, 4, 3, 2. Hold it at the top for 3, 2, 1. Exhale, 4, 3, 2, 1. Inhale, 4, 3, 2. Hold it at the top for 4, 3, 2, 1. Exhale, 4, 3, 2, 1. Energy in for 3, 2. Hold energy at the top for 3, 2, 1. Exhale to soften for 3, 2, 1. Take a really long, deep breath in and out your mouth, exhale. And now simply allow your breath once again to take its natural rhythmic flow. In yoga, breath is often referred to as pranayama, which is our life force. So even if it feels very soft, can you feel that sensation of life force entering in with each inhale and grounding you with each exhale? And notice if your mind is wandering, that is incredibly normal. Our brain is designed to think for us. But instead of wandering off with your thoughts, can you draw your attention back to your breath? And you might think to yourself as you inhale, energy in. And as you exhale, energy grounding. As you breathe in, energy in. Exhale, energy grounding. As you continue to just notice your breath, visualize in your mind's eye a warm, open field of grass. You might even imagine the feeling of the warm grass on your feet as you take a step. And as you step into this large, warm field of grass, you notice a very soft, warm breeze against your skin. And you decide to lie down. And you visualize yourself lying in this open, warm field of grass. Visualize the sun very gently, perfect temperature, warming your body. You start to notice the sun especially present on your face, bringing warmth and relaxation all the way down your cheekbones toward your lips. The warmth of the sun glows down your neck all the way toward your shoulders. You feel the warmth of the sun moving down your right arm, all the way toward your right hand, down your left arm, all the way toward your left hand. That warmth of the sun continues to move down your torso and your back, and you feel right now in this moment, your entire belly soften. You feel your back surrender to the ground, and that warmth of sunlight continues to move down your legs, all the way toward your kneecaps. If your mind wanders, you just come back to the feeling of your breath and back to the feeling of the warmth of the sunlight moving down your legs toward your feet. And you visualize as if you could see your body from an outside perspective. This really warm, very gently notice your breath. You think, I am inhaling energy. I am exhaling to ground. Inhaling for energy. Exhaling to ground. And as you observe your breath as you sigh out, either your nose or your mouth. Your body sun continues to shine upon you.
Thank you to Casey, and thank you everyone for joining us. Have a great rest of your week.